Now, all of us working in this field would know that PCOS has a very strong relationship with metabolic syndrome. Okay. Although metabolic syndrome is not one of the diagnostic criteria, but the relationship is very strong. And metabolic syndrome, we know that it constitutes the syndrome constituting a number of conditions like dysglycemia, dyslipidemia, obesity, and hypertension, or actually in Chinese what we call samgo, this condition. Right, so obesity is a cardinal component of the metabolic syndrome, and obviously this is the main theme of the conference today. Yep. So let's look at the epidemiology of obesity in PCOS. Now, actually this is a meta-analysis trying to summarize the epidemiology of obesity among women diagnosed with PCOS. And you can see that the sort of a small print, the prevalence of overweight or obesity actually is significantly higher in the PCOS group compared with those without PCOS. And the same applies to the prevalence of obesity, that means BMI more than 30, as well as central obesity. Okay. And in the meta-analysis that reviewed all the existing data, it actually shows that the prevalence of weight excess varies quite a bit among different countries, and is reported at up to over 70% among women with PCOS in some populations. Yeah. So this is a very common problem among women with PCOS that we have to deal with. And as the three previous the forest plots showed, women with PCOS had increased prevalence of both overweight, obesity, and also central obesity with a relative risk of around 2. So it's doubling the risk actually compared with women without PCOS. And the severity of the problem do differ among different populations, and in Caucasian women with PCOS, they actually had a greater increase in obesity prevalence compared to the Asian women with PCOS. Yeah. So probably due to the number of the environmental factors, lifestyle factors. Yeah. And this figure also shows that for women who belong to the normal weight group, so in the Caucasian population, they use 25 as the cutoff. Below 25 is normal weight. Between 25 and 30 is the overweight, and beyond 30 is obesity. So those normal weight population, the prevalence of PCOS is actually pretty low. It's below 5%. But if you go up to the obesity group, actually the prevalence of PCOS is close to 15%. Yeah, so this is a very weight-related condition. And this is a very nice study published by Professor Teet's group. Professor Teet actually is a very famous endocrinologist working on this field of PCOS and metabolic metabolic aspects of PCOS, and actually she is the leader leading the development of the international guideline. Yep. So she had a study in 2013 and studying women with PCOS for the 10-year weight gain, and actually the women with PCOS had greater 10-year weight gain compared to the general population. Yeah. And therefore, women with PCOS need particular attention to the regular weight monitoring, according to the guideline. And actually, the obesity problem in PCOS is genetically predisposed. Mendelian randomization analysis have shown a high BMI among women with obesity-related genotype, with an oscillation of close to 2. And there's a meta-analysis which suggested that the polymorphism of the FTO gene, so this is a fat mass and obesity associated gene. So a polymorphism in this gene was simultaneously associated with the risk of PCOS, in that the A allele is a risk factor for PCOS susceptibility. And you can see quite a number of these studies are in the Chinese population. The largest one is in the Chinese population, and a few in Asian populations as well. So this is pretty relevant to our own locality.